Hi, class. Welcome to topic two, in which we talk about mental health disorders and emotional health. Mental health disorders is a comprehensive topic that alone could span a 12-week course. It is impossible to squeeze all the things that would be important to know about mental health disorders into a 1 week topic. However, I'm hopeful that the information provided through this lecture, through the TED Talks, and through the additional readings on Blackboard will provide you with a sufficient amount of information so that you walk away with a better understanding of mental illness and what it is, and a better understanding of some of the mental health disorders that exist as per the Diagnostic Statistical Manual, which is used to diagnose mental health disorders. Throughout this lecture, we will focus on the following topics. First, an overview of mental illness. We'll move on to depressive or mood disorders, which will then take us to a conversation about anxiety disorders, then schizophrenia, and then we'll focus on just one childhood disorder, which is autism, and then move forward with talking about some warning signs of mental illness and prevention, which in this course is focusing on your emotional health. It's important to understand that mental illness is a disease. It's not the sort of thing that you just grow out of, that you can just shake off, or that you need to just get over. It's a disease, and it causes some changes within our bodies, and it could cause mild all the way up to severe disturbances in our behavior, in the way that we think, and that impacts our ability to be able to handle the demands of life and to work through our daily routines. When you look at the DSM, which is the Diagnostic Statistical Manual used to diagnose mental illness in America, there are over 200 recognized forms of mental illness. When you look at all of the different diagnoses, some of the most common symptoms that you see reoccurring are changes in the way someone feels, their mood, changes in someone's personal habits, changes in someone's personality, or social withdrawal. Mental illness has both a physical as well as an emotional or psychological component. And problems with mental health at times are related to stress and stressors in our lives and triggers that may happen. And it highlights the importance of making sure that we are living emotionally healthy lifestyles and making our emotional health a priority. Most of you likely on a yearly basis go to your doctor for a physical where you get your blood work done, your blood pressure is checked, and the doctor makes sure that all of your systems are functioning as they should. Unfortunately, much of the time, we do not take enough time to focus on our emotional health in the same way and to do those yearly checks, or those checks could occur more often than yearly, to ensure that we are okay emotionally. And that's very important to do. It can be difficult to truly pinpoint what may have caused someone to develop a form of mental illness. However, both environmental and biological factors should be considered. Environmental factors focuses on someone's social, cultural, or their physical environment. This can include how a person was raised, maybe stress that the person is facing from a particular situation or maybe a series of events, as well as current expectations in a person's community. Those environmental factors might be a contributing cause of what may have led someone to develop a diagnosable mental illness. There are also biological factors that need to be considered. There might be disturbances in our body system, chemistry, or the brain. Also, the genes that we inherit from our parents can make us more susceptible to certain types of mental illness. And then, of course, a combination of both environmental as well as biological factors could impact whether someone develops mental illness. In the United States, mental illness is fairly common, with approximately 18% of adults diagnosed with a mental health disorder each year. Although mental health disorders are fairly common, when we're thinking about more serious forms of mental illness in adults, that is much less common and impacts about 4% of the population. Because of the impact of mental illness on our population, there has been a great deal of research done to determine how to effectively prevent, diagnose, and treat mental illness in children, adolescents, as well as adults. So we move on to a discussion about mood disorders. Mood disorders includes depressive disorders such as bipolar disorder, major depressive disorder, and persistent depressive disorder. However, there are a number of other different forms of depression which are touched upon in some of the reading that is in the course documents section of Blackboard for this week. These include psychotic depression, seasonal affective disorder, and postpartum depression. In a given year, about 10% of the adult population in the United States will have a mood disorder. The median age of onset for mood disorders is 30 years old, but depressive disorders can occur anytime throughout one's lifespan. Depressive disorders can also co occur with other disorders such as anxiety and substance abuse. Of all the depressive disorders, major depressive disorder impacts the most people in this country. About 6.7% of adults in a given year will tend to be impacted by a major depressive disorder. It's the leading cause of disability in this country for adolescents and adults ranging from ages 15 to 44. It tends to impact women more than men. And although it could develop at any age, the median age of onset is 32. More recently, the age of onset is commonly taking place in adolescence and young adulthood. There are a host of defining features of a major depressive disorder. These include sleep disturbances, recurrent thoughts about death or suicide, possibly a suicide attempt, psychomotor agitation, feelings of inappropriate guilt or helplessness, indecisiveness, or a reduced ability to be able to concentrate, depressed or irritable mood for most of the day, significant weight loss or weight gain, fatigue, and loss of energy as well as marked diminished interest in those activities that one once found pleasurable. In order to be diagnosed with a major depressive disorder, someone needs to display five or more of those symptoms that we just went over every day for approximately 2 weeks. The symptoms need to cause clinically significant impairment in their lives. That could be socially, with their occupation, educationally, or other areas. And symptoms cannot be a direct result of bereavement, coping with the loss of a loved one, substance abuse, schizophrenia, or a general medical condition. Persistent depressive disorder. This describes a disorder in which one has a depressed or an irritable mood that needs to be present most of the day, more days than not, for approximately 2 years. In children and adolescents, the criteria is 1 year. The individual is not symptom free for more than a period of 2 months. Some of the symptoms of persistent depressive disorder resemble the symptoms of a major depressive disorder and can include feeling hopeless, having low energy, a poor appetite or overeating, low self esteem, and having a hard time concentrating as well as making decisions. There are risk factors that might impact the likelihood of someone being diagnosed with a persistent depressive disorder. Females, women, are more likely to be diagnosed than men, having a family history of depression. Difficulties with interpersonal relationships are important. If someone has an adverse family environment or they have poor attachments to caregivers or to other family members, maybe discipline at home might be harsh. Prior diagnoses of disorders such as ADHD and conduct disorder, although as part of this presentation, we do not delve into ADHD, it is one of those um, disorders that's commonly diagnosed in childhood that could impact someone across the lifespan. Cognitive vulnerabilities are also an important risk factor. So, if someone has negative beliefs about themselves, the future, the world, and stress, so how does someone respond to stress and how do they interpret events in their environment? How resilient are they? How capable are they of being able to bounce back when things happen? All of these factors are important to consider. Bipolar disorder. Bipolar disorder impacts approximately 3% of adults each year. The median age of bipolar disorder is 25 years old. There are two types of bipolar disorder, bipolar 1 and bipolar 2. In bipolar 1, an individual displays one or more manic or mixed episodes. These episodes are not better explained by other disorders such as schizophrenia. And mixed episodes meet the criteria for both manic and major depressive episodes almost every day for at least 1 week. With bipolar disorder 2, an individual displays one or more major depressive episodes and one hypomanic episode. And again, it's not better accounted for by disorders such as schizophrenia.